name is Faustina Momoa Fotenkpa. I'm from Ekunfi district. Precisely, I'm in the Imuna Chips zone. Today's workshop was so interesting, talking about the rehabilitation. So, okay, adolescents, how do we rehabilitate them, especially those with disabilities? We learned today that we have to go to the schools, to the CWCs, wherever we find them, to register them. Wherever we find them, to register them. Now our appeal to government to help Ghana Health Service to create these centers for us, because they are also like us. We shouldn't neglect people living with disabilities or disabled people. So I really appeal to NGOs, anyone at all who can help us to help our adolescents who are disabled. It's really affecting because we don't have this rehabilitation centers. The parents keep these children in the rooms. When we get this rehabilitation centers, we can, during our home visits, we can tell them, oh, there are rehabilitation centers here that can help your child.
My name is Fideline Kafui Che. I am a district public health nurse in Ewutu Senya district, and I'm a facilitator for this program and regional resource person for adolescents. Frontline health staff, where we call focal persons on adolescents. This adolescent issue is a problem in, I think, I must say everywhere, and it's not well identified. We don't really identify or recognize our adolescents in our health sectors or health service delivery. And so the purpose of this meeting since yesterday was to introduce them to the new policy or guidelines that we have on adolescent issues. The issues concerning adolescents, we talked about the e-learning. The e-learning actually helps them to be abreast with the current trend that our adolescents are. For instance, Instagram and post-up things that they do. And so we think that if our staff or focal persons in adolescents also have a knowledge on this, will help in providing services. We also think that in Central Region, we have 15% or more than 50% of adolescents getting pregnant. And so it is a special need that the region has to train our health staff so that they can equip themselves with this knowledge that they can be able to take care of the adolescent. We talked about the structures that are in place, the approaches, and then the models that we use to help them, that we can be able to do what? Achieve our aim. Our frontline health staff are really doing well because they actually have a little knowledge about it. But the challenges attached to it, the structures are not in place. The infrastructure is a challenge, and we need to look at that. We also identified that the adolescents with a special need are not captured, and you realize that in Ghana we don't have data on disability with our adolescents, and so today we try to introduce to them why there is a need for them to assess the severity and the care that we need to give them. We need to collect data so that we can make more research on them. We also talk about a safety net. This is a project that has been carried out some time ago, and we realize that it is working well. And so in the region, we introduced this safety net program that they have to integrate into other areas of service, that they trace or look for or identify the pregnant adolescent so that they take care of them from antenatal till they deliver. And the main motive behind this is to send them back to school or learn a trade or vocation, so that they don't get pregnant again. And so this is what we are trying to do. And for that one too, we have registers and tools that we can collect data on them, so that we can carry out a total implementation plan on them. And I think so far, so good.
I'm Osman Nura from Ekunfi District. We came for a workshop organized by UNFPA and Ghana Health Service. Our facilitators taught us about adolescents with special needs. So they made us realize that there are adolescents in the house who are visually impaired. They don't have abilities to access health facilities. They can't move from the house. So we have to go back to our facilities, identify them through home visits and register them, so that we will give reports to the national for them to come back and negotiate with the social welfare and know what to do for them. Everybody has something in them. So yes, the person may be disabled, but God has given them a hidden talent. So they should identify the talent and build on it, so that the child too can be somebody in future.
My name is Seto Usu. I'm from Upper Denshaw West. Today's assessment has been a great one concerning the adolescent getting to know the health factors. And even though they go through various stages because of their the physical changes they go through, we've been able to identify ways to help them go through several stages to adulthood. And concerning the adolescents, this program has been a successful one. And we are going to make sure we impact the knowledge that we have here on our various communities to help the adolescents have a very good life. At first, we thought the knowledge of adolescents were just mere factor, we just have to let them know some petty things. But upon this program, we've been able to identify that the adolescents are the most important factors or important people in the nation building.
My name is Essence Grace from Upper Denshaw West District, precisely Subin Health Center. Actually, the program we attended today about the workshop that the Ghana Health Service organized in collaboration with the UNFPA. We've realized that most of the times society have some kind of perception when it comes to babies or adolescents with autism, cerebral palsy. They are all, and etc. They are all health conditions that can be managed in one way or the other. So what we are telling the people or the community parents out there is that most of the times when they have children like that, they shouldn't associate it to some kind of a curse or as a result of a gift from the baby coming out as a result of a gift from one goddess or god, smaller god somewhere. They are all human beings. They should seek for medical interventions. And then what we learned here today have also taught us that we, the health workers, most of the times when such people come to our facilities, we usually discriminate, which is not so good. They are like us, they have some potentials in them, and then we are the ones to even support the parents to take care of these children to become better people in the society. We should also create facilities for them in our hospitals and then health centers. For instance, those that cannot walk, the restriction, those who have restrictions in movement, there should be a pathway for them, so that when they are coming in their wheelchairs, they will be able to get somewhere to also tread on.
And so we want to handle them with care, because they always get confused whether they are children or they are adults. And so we don't pay particular attention to their needs. And this is a training that we organize for the focal persons if in 6 districts in the central region to start with. It is necessary because the population, in our population right now, there are over 22% of our population. And in future, there will be the people replacing us. And so if we don't take care of them now or provide for their needs now, you can imagine the type of adults or people or authorities that we'll have in future. And so this is the time for us to identify all these needs so that they become good adults and provide for the nation in future. We were given a statistic for US that is about over 24.4% of their population has a need. And so Ghana, we don't have data on them at all, which means that we don't cater or we don't capture any data for special needs for disability among the adolescents. And so we need data. And so this is about documentation. If we try to document whatever we do, it will help us capture whatever we do, so that we can plan for them and make more research on their needs. So I think it is time for policymakers to come in. Our MPs, our district assembly members, they are here. They are now. It is time for them to realize these things so that they start planning for them. Because when we come down to the community level, you realize that these children with disability actually have a different perception. Our people have a different perception about these disabilities. Either they are coming from small gods or something else, and so many of them are hidden in the rooms, and they close the door or they lock the door at them and then go to their workplace and come back to meet them. And so we need data actually to capture so that we can plan for them, and then they also feel accepted into the society.
So basically I'm here to discuss with the frontline officers manning various adolescent health corners in the region on how they can provide gender-sensitive reproductive health services to adolescents to improve access. We know that because of our gender constructs, a lot of adolescents are not comfortable going to these corners to talk about their issues, but we are all working towards promoting comprehensive sexuality education and promoting access to sexual reproductive health information and services, especially for the adolescents. And so to be able to do that, we need to create the enabling environment. Thus, we must be gender sensitive to the needs of the girls, to the needs of the boys, and how this affects them. And so today I basically interacted with them on the importance of being sensitive to the needs, and then also the need to be confidential, not to be judgmental, to be welcoming and to be friendly to these young people so that they can seek the services, and then all that we are all working towards in reducing adolescent pregnancy, in reducing child marriage, in reducing sexual and gender-based violence, we can all work together in a very sensitive manner to reduce it, if not end it.
Whatever is good for the good boy there is good for the how do we call him, disabled child too. And so we are talking about universal coverage, health coverage for everybody. And so if we are doing, we are giving care to our adolescents, that same care should go to the disabled child too. And so I think it will be good, because we are only capturing some people. For instance, a pregnancy. Some of them get pregnant, but because they are hiding them in the rooms, we don't get them. So we need total data, or the real picture. Yeah, the training we give our focal persons right now is that when they go into the community, they must do the individual counseling, and then to the family as well. They must understand the situation in which that small boy or that adolescent boy or adolescent girl is. The family support is needed, the health support is needed, financial support, and all other supports are needed. And so I recommend that our people should be able to let our family and community members understand the disability and their special needs, so that we can get them. If they understand, they'll bring them out. Yeah, it's because of the misconceptions they are doing that. They are not bringing them. Now we make them understand the ties, the model and approaches that are involved in the new policy, and that is what they are going to practice now. Previously, they don't actually understand what we call standalone facility for adolescents, or mainstream, or we now differentiate it for them, and so they know where they belong and what they are supposed to do.
The adolescent age itself is an age with a special need, because this is the age where the children are going through physical, psychological, and hormonal transformation, and that even makes them attractive to the opposite sex. Aside the adolescents with disability who also need special care, the adolescent age itself is a special age that needs serious reproductive health services and information. And so for me, if you want to understand the need, reproductive health need of adolescents, I believe all of them equally have a need. But the adolescents with disability is more vulnerable because of his or her condition, and so must be given special care when it comes to how to access the environment, how to access the services, and even not being discriminated against. And so basically for me, that sums it up.
So that is why you are there to provide referral service in that event. No. A man cannot be raped. Only a woman can be raped.